Hello there, practitioners, and welcome to Learning with Princess Ayesha. I hope you're all doing well. If today is your first time of coming across my channel, you are most welcome. Don't forget to subscribe to my channel. Don't forget to like, comment, and share. So on this platform, we teach practitioners on how best, and parents who happen to chance on this video, on how best they can support their children within the home setting, preparing them for school. So my name is Ayesha, hence the name Learning with Princess Ayesha. So our teaching is based on the EYFS statutory educational framework, which guides practitioners in how best to support children's learning and development. So today we're going to tackle more on understanding of the world, and we're going to talk about the people who help us. So these are some of the people who help us, but we're going to focus on one profession, that is the dentist. I mean, all these professions, they have their role that they play in helping us in the community. We're going to talk about the dentist, the role of the dentist, and oral hygiene in general. So within the EYFS or the development matters, it highlights the need for practitioners to educate children on oral hygiene, basically how they can take care of their oral health, everything to do oral, everything to do with the mouth. So so like I said, we will be providing, I'll take you through some of the dental resources that can be used, incorporated in your activities when you're setting up for that. So oral hygiene basically is, you know, taking care of your teeth, your mouth, you know, so brushing of the teeth. So in simple terms for children, brushing of our teeth with toothpaste, which has fluoride in it. The purpose of fluoride is to keep your teeth healthy, nice and healthy. And also the tongue as well, because sometimes children do get halitosis. Halitosis basically means bad breath. So as a result of a lot of bacteria in the tongue, on the tongue. So it is pertinent that when children brush their teeth, they also tackle the tongue, because a lot of the bacteria, you know, it's in the tiny pores within the tongue. And so I do have a bit of resources. So what you can do to support this is to maybe have a storybook about, you know, oral hygiene. You can read that to the children, and then practically demonstrate it by talking to the children about, you know, a visit to the dentist, you know, what they saw at the dentist, why they visited the dentist, and, you know, yes, basically a visit to the dentist. So the reason for teaching children about oral health, and basically this also comes under PSED, personal, social, and emotional development, as well as, you know, physical development, because obviously they'll be using their hands to, you know, so fine motor skills to be brushing back and forth. And yeah, so this is a mannequin or our tooth model, or yeah. So we can see that the back teeth is called molars, and these two smaller ones are called premolars, and these are the inside. We have the incisors, we have the canine. The canine is for you know, tearing. The incisors is for biting through food, but the canine is for tearing. We have the premolars, and the molars, the back teeth, is for chewing and grinding of food. And so this is a tooth model, and you can also incorporate in the toothbrush. So we can ask the children, what is the toothbrush used for? The toothbrush is used in brushing of our teeth, and when brushing our teeth, we need a toothpaste high in fluoride. The fluoride helps to keep the teeth healthy. And also children are to brush about 5 minutes for 5 minutes in a circular motion. So circular motion, pardon me. So circular motion, the brush circular in a circular motion, gently, not too hard, in order not to cause bleeding. And then around the gum area, because the gum is very essential in dentistry, because the gum, let's say the gum is more like a cement that keeps the teeth in place. So once the gum has receded, so we call gum recession, has receded. Once the gums have receded gums, the tooth becomes loose, consequently allowing the tooth to fall. So it is very pertinent that when children are brushing their teeth, or even adults, they brush in a circular motion, for about 5 minutes. So sometimes the children can time themselves. So once the timer beeps, then they know that, oh, they have to stop brushing, isn't it? And now there are even dental tools such as electric toothbrush that will even aid in brushing, effective brushing, mostly tackling around the back of the teeth, you know, which are hard to reach areas. And also it is pertinent to avoid, you have to teach children that they have to eat a balanced diet, particularly food high in calcium and vitamin D, which is very essential for bone health as well as strong teeth formation. And especially for children who are growing up, we know that the baby tooth, you know, from 6 going, baby teeth starts to come out, you know, fall out. And some babies are born with teeth in their already erupted, you know, coming through. So yeah. And so when children are teething, they normally drool a lot of saliva from the salivary glands, you know, coming out a lot. And also children do get maybe red cheeks, you know, red cheeks, a bit of temperature. And so the dentist might advise some maybe Calpol to cool down the temperature, and also a teething ring. You know, parents can put that teething ring in the fridge for it to get cold, so that it becomes soothing for the child as this is more for like babies, you know, babies, toddlers, you know, they're around that age. They can bite, because the teething ring is very hard. When they bite on it, they become more comfortable. I quite remember when my wisdom tooth was coming, I was so uncomfortable. So even you, the adults, you become so uncomfortable and it's very painful. So what I did was, I was eating a plum. I love plums, juicy plum. So I was eating plum, and then the seed of the plum, I just put it at the back of my teeth, and then I, I bit hard on it, and that as consequently that the wisdom tooth, went in place. It was fully grounded, and I was a bit comfortable. So just imagine, you, the adult, you are so uncomfortable because your wisdom teeth, your last, is coming through your wisdom teeth, obviously, and which is very, very, it's very, very, painful. And so that's how I was able to get a well rooted wisdom tooth, and that I was comfortable afterwards. So just imagine little ones, teething and what have you. So we have to encourage children to eat foods that are high, a balanced diet, really containing all the essential nutrients for their overall well-being, as well as foods that contain what do you call it, vitamin D and calcium, as well as vitamins. So therefore, and vitamin C. So in case there's a wound or whatever, maybe cold sore around the mouth area, I mean, we know that vitamins, the purpose of vitamin C, it promotes the healing of wounds, which is very, very essential as well. So we have to teach children that they should not eat or have foods that are high in sugar. These processed sugars is not good for them, because that can cause type 2 diabetes. We know that type 2 diabetes comes about as a result of lifestyle, whereby type 1 diabetes can be more like hereditary. However, type 2 diabetes is mainly lifestyle. So if you are snacking on unhealthy snacks, it is very pertinent that practitioners, teach children the importance of eating a very balanced diet, and also cutting down on foods high in sugar and salts. Because what the sugar does is that it causes tooth decay or dental caries, and dental caries is caused by bacteria, as a result of eating too much sugary foods and snacks, which creates cavities. What are cavities? Cavities are tiny holes inside the tooth. And most often, well, adults do get cavities, but mostly in children. Children like sweet things, and especially people who have sweet tooth. Snacking on twist, or what's it called? This Skittles. Skittles is high in sugar, very high in sugar. So yeah, children need to, and what do you call it, tango drinks and what have you, 7-Up, Fanta, they are all sugary. Sometimes, these drinks, they do right at the back that, low in sugar or whatever. But you all know they are all hidden, They tell you that, but yes, the sugar content is very high. So you have to cut down on that. That is if you're an adult and you want to, keep those teeth, because once the adult teeth comes out, 32 in number, once one even fall out, you are doomed, because getting an implant is very, 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 very expensive. One tooth, can be priced, 2,000, 3,000 plus. So it is very good to look after your teeth, your adult teeth. We know baby tooth, it would eventually fall out, and then once it falls out, the adult tooth comes in place, which is more permanent. But the baby tooth is more temporary because they do fall out. Yeah, so by the age of, let's say, around 12ish, they should have their adult tooth, most of them, in place. And some children are also born with baby teeth. They have some missing teeth, so if they are able to look after their baby teeth, and it's not that too tiny or too prominent on their maxillofacial whatever at least they can keep it. So that is it. So yeah, toothpaste is very, you need a good toothpaste accompanied with a good toothbrush, because these are the two key tools that you need for effective toothbrushing, isn't it? And we did say earlier that it is very pertinent to brush for approximately 5 minutes, not less than that, to have a thorough clean of the teeth, and not scrubbing hard, because you wouldn't want to, in order to avoid abrasion. Yeah, so gently, circular motion brushing around the teeth, which also aids in circulation around particularly around the gum area that is very essential for the nerves in the tooth, isn't it? And so most toothpaste have some of the things it tackles. So for instance, this toothpaste, I don't know whether you can see, this toothpaste highlights some of the things that it tackles. First of all, it says with fluoride. So Dentox with fluoride. So it's good. It has fluoride content in there. Tackles tartar protection, cavity protection, plaque protection, strengthens tooth enamel. So again, the fluoride strengthens your tooth enamel. And what is an enamel? So the outer bit of the tooth can be referred to as the enamel. Yeah, the whitish bit is your enamel. So it is obviously very prominent or visible. So when somebody has yellow teeth, people normally say they don't brush their teeth, but that is not really true, because once the enamel wears off, there is an exposure of the dentine, and the color of the dentine is yellow. So if you see somebody who has yellow teeth, it means that their enamel has worn off, and therefore exposing the dentine. And we know that dentine is the part of the tooth which has a lot of nerve endings there. A lot of the nerves are there, so which causes teeth sensitivity. So somebody who might drink water and say, oh, this is very cold, or they might eat warm food or hot food and say, oh, get a bit of sharp sensation in the teeth as a result of the nerves within the dentine. So we would advise such a person to obviously use a tooth high in fluoride in order to, and also avoid acidic food, because foods that are high in acid, such as citrus fruit, oranges, lemon, and grapefruit and what have you, what they do is that they wear off your enamel. The enamel is more like a protecting the dentine. So once it wears off, it exposes your dentine, and therefore you have something called tooth or sensitivity. So it is very important to, use a very good toothpaste. Also, it is very pertinent to avoid using, what do you call it, toothpick. And the reason, although the dental floss, this is a dental floss, and the purpose of the dental floss is to remove bits of food, particles within the teeth, such as bits of anything you eat, meat, what have you, particularly meat, because once meat gets trapped in between the teeth, it causes decay and smell. So it is very pertinent that anytime you eat foods, you use after brushing, you use either a dental floss gently in between and then you gently, to floss, or you use a dental, what am I even saying? You use you floss your teeth. I'm trying to. Yes. So you floss your teeth instead of using your tooth. I'm trying to remember, all back from my dental nursing time. Anyway, or to avoid using toothpick, because toothpick can cause greater holes in the teeth. So you use your floss. Use your floss. The floss is more like a rope, a long rope that comes. Sometimes it's very long, so you have to cut a bit, and then you use it in between the two to get off the food particles. It plays the same role as the interdental brush. So this is called an interdental brush. So it is very pertinent that you use an interdental brush used to, in between your teeth to remove food bits instead of toothpick, because the interdental brush is smaller, so it can fit into the inside of your teeth, rather than unlike the toothpick is very, very, very broad. So if you use toothpick, what you are doing is creating more hole, weakening your weakening the tooth, because you are creating hole around the tooth, therefore allowing a breeding ground for bacteria, because as you eat, food goes in there in the hole that you've created, and with time, if you don't floss, they eat away the tooth gradually, thereby weakening the gum, consequently resulting in a very loose and wobbly teeth like this, wobble, 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 and eventually the tooth falls out. So in order to avoid that, you need to use your interdental brush or your floss. And then it's also good to use mouthwash to freshen the mouth as well. And it's important to brush twice a day, so in the morning and last thing before you go to bed. Never go to bed without brushing your teeth. Then it means there will be party in your mouth, because all the bacteria, the plaque and what have you, they will be partying in your mouth. So ensure that you do brush twice a day. We have to teach children. Also, when children do happen to have cavities in their mouth, and they do go for dental checkup, there are options. They normally use fissure sealants to seal the hole, because they are children, and so they will just gently clean the place, the tooth, and then use fissure sealant, and then they will cure it. And I don't want to go there, but just briefly. And then for adult, there are two type of fillings. So we have the composite filling, which is the white filling, and we have the amalgam, that is the silver filling. The amalgam comes with effects because obviously mercury content and what have you, whereby the composite filling, the white filling, is a bit much safer. And aesthetically, the white filling is much preferred because obviously it's not more prominent. Yeah. So this is just by the way. So when you do go for dental checkup, and when you do lie on your dental chair, the dentist will put on their visor, and then the dental nurse will also put on their visor to shield, protect themselves from any splashes as a result of using the cleaning the teeth. They will also wear a mask, protective masks, all part of PPE, personal protective equipment, that protect them, as well as the clients or the patients. So, and at times too, before you even get referred, some children do get referred by their doctors. So this is called a stethoscope. They do get referred by their doctors or their GP to the dentist when they do go for a thorough check. And then obviously the doctor will maybe refer, maybe they have issues pertaining to their oral hygiene or in their mouth or whatever. They will ask them to go to the dentist because they are the right professionals to tackle that area. So this is just by the way. So this is within the setting, you can use maybe toys, maybe a book, a reading book about brushing of teeth, the right resources, and then maybe use maybe bear or whatever. The bear is brushing the teeth and things like that, to teach children about oral hygiene, which is very important. So I do hope that and this oral hygiene, what we just discussed, can be linked to the characteristic of effective learning, also the understanding of the world, the role of the dentists within the community, also physical development, the use of their fine motor skills in the brushing of their teeth, and what have you. So practitioners, I do hope you enjoyed this video, and I think I do have a video on the people who help us, or a couple of videos pertaining to healthy eating and what have you. I'll put a link in the description. Please do, if you are still with me up to this point, please give me a thumbs up, and if you haven't subscribed, why not? It's educative here. We do learn a thing or two, and I believe you've learned a thing or two. So please kindly subscribe. Don't forget to turn on your bell icon for notification. Don't forget to comment if you have anything to say. Don't forget to share the video far and beyond. That way we get to grow the channel and we get to educate others. I thank you for your time, and do take care. And it's a goodbye from Learning with Princess Ayesha. Bye.